Hello, Kay McGrath with you today, and a quick question for you. When you visit your local GP and settle into the waiting room, does your heart rate go up, your pulse start beating? Well, for many people, particularly older Australians, a visit to the GP can be quite a worrying and confusing time. But the good news is there's help at hand. There's an international campaign that's underway to take some of the worry and the stress out of dealing with medical issues. It's called Choosing Wisely. And joining me today is Dr Justin Coleman, and he's going to talk through these issues and hopefully have us all feeling a whole lot better and our heart rates down by the end of the process. Welcome, Justin.
Oh, thank you very much, Kay.
First question, tell us what Choosing Wisely is all about.
Choosing Wisely is a program started by NPS Medicine Wise in Australia. It actually began in the United States in 2012 and was brought to Australia a couple of years ago. And the concept of it is that each college, so each group, the College of GPs, College of Surgeons, Physicians, etc., comes up with a small list of 5 things which we feel might be overdone, overused in medicine.
Well, Matt, we'll get to that, definitely, but maybe if we can just unpack this a little bit. Why, first of all, you're a GP, why does our heart rate go up when we visit our doctors? What
Sure.
is that about?
Look, it's a for the GP's space. As a GP, that's where we live. But of course, as a patient, you're there perhaps once a month, perhaps once a year, and it's usually at the time you have worries, concerned about something. So in some ways, you're quite vulnerable. I think it's a foreign place, and you're also in a position where you have to reveal a bit about yourself, maybe some things which you're quite anxious about talking about. And so it's quite understandable really that patients, when they go to their GP, would be on the whole feeling a bit uncomfortable.
Right, so Choosing Wisely is going to put the general public, patients and consumers, more at ease. How? By helping us have that conversation with the GP?
Well, one of the approaches of Choosing Wisely is trying to empower the patient to ask questions of their GP or specialist doctor. So traditionally, I guess the role of the doctor has been seen as, the wise person in the swivel chair and sort of dishing out advice, and it's a bit of a one-way traffic flow. We're moving much more these days into, a sharing of responsibility and a sharing of control and decision-making in a consultation. So Choosing Wisely, one of the features of it is that it helps that shared decision-making process.
And we're actually going to give the community some tips, particularly 5 tips, or questions that you can ask your GP. But there's another angle of Choosing Wisely as well, isn't there? And that's perhaps about educating consumers about the need for medical testing, intervention. Tell us a little bit about that.
That's right. So as part of the concept of the doctor sort of giving out advice or doing things is always traditionally been the concept that you go to your GP and you end up leaving with a prescription, something printed out of the printer, a prescription or a referral for a test or referral to a specialist. So Choosing Wisely, part of that is trying to educate the public and also doctors amongst themselves that often you don't need to walk out with one of these things. So there are many cases where you go to your doctor, you present the problem, the doctor takes a history, examines you, you come up with a solution together, but that solution doesn't necessarily involve, one of the wonders of modern technology, that being, medications and tests and treatments, which are fantastic that they exist, but they're not always useful. And Choosing Wisely is trying to remind us of that.
So are you suggesting that perhaps we're being over-serviced?
Look, I think if you look at overall at a population level, yes, I think there are probably too many tests ordered in places where they're not overly useful, and too many prescriptions given where the evidence says that they're probably not going to make a difference. It's not quite as simple as over-servicing, which sort of implies that it's done for the profit motive. In fact,
I was going to, sorry to interrupt, I was going to ask that because I'm sure there will be some who perhaps are suspicious that because Choosing Wisely is funded by the federal government,
Sure.
is this an attempt to cut costs, as you say?
Certainly from the clinician's point of view, so the colleges who are making these recommendations, there's no particular incentive to cut costs. Of course, costs should be a part of the decision. If two tests are equal, for example, or two medications are equal, generally you should choose the cheaper of the two, or if none is necessary at all, you should choose none. So inevitably there will be flow-on effects in terms of saving some money, which I think is a good thing for the health system. But the actual recommendations chosen by each college are firmly chosen because of benefit to the patient. So it's trying to avoid harms of some of these over-testing and over-treatment.
So this is evidence-based and it's led by health professionals.
That's right. So each college is entirely free to come up with whatever 5 recommendations it wishes. There's no government input into what the recommendations should be. And indeed, although we tend to run it by each other because we're quite collegiate, each college decides for themselves without reference to any other specialty college. So it's a very free hand, and it's based on things which are done reasonably often and things where the evidence says they should be probably done less often.
I'd really like to talk more about that, but first of all, let's get to those 5 key questions that Choosing Wisely wants to arm consumers with. So the first one is, do I really need this test or procedure?
Well, I think that's a central part of the whole concept of Choosing Wisely. As I say, many tests and procedures are very useful. So there's very few recommendations that say, for example, never do a CT scan of this part of your body or something like that. But all the recommendations do have caveats. That is, they're saying, well, instead of every person with a sore knee getting a CT scan of their knee or a sore back, choose wisely. Only choose the few where it's shown that it will benefit. So the whole concept of the thing is, do you really need that test in the first place in your individual situation? And
then naturally the next question, it's pretty logical, what are the risks attached to this test or procedure? Sure.
So some of the tests recommended, for example, colonoscopies, are invasive tests and have known potential problems. Others, like, for example, I mentioned CT scans. CT scans in children, if you do enough of them, it slightly increases the risk of the child getting cancer in their lifetime. Now, of course, that's only a small increase in risk, and certainly if you have to do the CT for a very good reason, the benefits far outweigh it. But, if you have an approach where every kid with a headache gets a CT of their head, then that can be a harmful approach just because of the risks of having the procedure. And even more so probably with treatments, because realistically every treatment that actually works, that contains an active substance that alters the chemistry of your body, whether it be an antibiotic or a blood pressure tablet, every treatment almost by definition has a potential to cause harm. Yes. And so doctors naturally have to weigh up the benefits versus harms.
And so question 3 is there a safer option?
That's right. So as I said, the Choosing Wisely recommendations tend not to be an all or nothing phenomenon. They tend to be, in these circumstances, yes, it may be very useful, but in other circumstances there may be a safer option. I mean, a classic safer option for many of the treatments would, for example, be exercise, because even though a trial of a drug may show that it slightly decreases the risk of something, having a heart attack or whatever it may be, there will be lots of other trials that show that doing daily exercise also decreases the risk by about the same amount. So often something like exercise or a lifestyle change might be a safer option.
And question 4, what if I don't do anything at all?
Yes, and that's not often asked, I must say, but it's important to ask, and I think certainly particularly if you're already having a lot of things done to you, and for older patients, older people, that's a common thing. They're on a lot of medications already. They have a lot of specialist appointments already. The question, perhaps in this case, should we wait and see? I think is a very important question, and it's possibly underutilised, I think, that plan of action, which is, careful observation over time.
I'd like to come back to that one, but question 5 then, what is the cost?
So we mentioned cost earlier. Cost is not the primary consideration when we're coming up with these recommendations, but certainly in terms of financial costs, overall, some of these treatments do cost, tens or hundreds of millions of dollars to Australians each year. There are also other costs as well, and some of those costs are that if you start off on a course of treatment or investigation which in retrospect you didn't need, and you start to find things which are a little bit wrong, although it turns out they're not, should never really have been found, that then leads to further investigations and further costs and a lot of time and hassle for the person undergoing it all, and often concerns as well. So if someone has a sort of mildly positive result on a test which they perhaps never should have had, then they have to wait and they're worried until they get the next more expensive invasive test to rule out any problem.
So just recapping those 5 questions. 1, do I really need this test or this procedure? What are the risks? Are there, or is there a simpler test or option? What if I don't do anything? And question number 5, what is the cost? And we'll recap those questions for the viewers. But how are the GPs going to react to being questioned? How are they going to respond to that?
Look, it's sometimes it can be a bit of a challenge for the GP, although more often it's probably a challenge for the patient sitting opposite them. As we said earlier, sometimes the patient's a bit nervous, and particularly with a GP who's, or specialist, as a doctor really, who's quite forthright and confident, it can actually be a hard thing to ask any of these questions. Having said that, the doctors who I admire and whom I would send my family to are the sort of doctors who in fact welcome that sort of discussion with patients. When it comes down to it, us pontificating from on high, if the person in front of us doesn't really believe or understand the process, the management plan, it's actually far less likely to happen, and there have been very good studies showing that correlation. So I think if you can engage that two-way conversation, nut out any difficulties that person's likely to have with your management plan or your tests or treatments, and everyone ends up being on the same page, I think that little bit of extra time actually really enhances outcomes.
Can I put you on the spot a little here and ask you,
Sure.
What should people do if they're not comfortable with their GP?
Well, to me, a GP is perhaps not a lifelong, but certainly a long-term investment in your health. Choosing a GP you're comfortable with, your family is comfortable with, and there are absolutely brilliant GPs out there, and I think Australia is very lucky to have such a high quality standard of general practice. I must say, to me, if I was not happy over a long period of time, perhaps it's hard to judge once off. If I wasn't happy overall, I would tend to be looking around for another GP, just someone who you feel comfortable with your style,
and possibly can build a relationship with, as you say, over time.
Yeah, I think the long-term relationship's crucial for
Yes.
health outcomes.
Yes, I've got a fabulous GP, I can tell you, and he's
Good to
actually, he helped with my babies when they were born, and my youngest is 25, so that's been an ongoing and a really successful relationship. What other tips can you give about getting the best out of a visit to a GP? For instance, if people are a little uncertain, or they're worried, or they're confused, should they take a friend, a relative?
Yeah, I think communication's really the key. So if you are comfortable communicating, answering questions, which your GP asks you, then that's the ultimate aim. If you're less comfortable, perhaps taking someone along with you, if English is a second language, perhaps taking a relative there as well. In the end, I think your chances of getting the correct treatment at the correct time, the correct dose, the correct place, all those things really are enhanced by the confidence of the patient to communicate accurately their problems to the GP.
And perhaps take a list of their concerns. But there are many ways that people can actually maximise that time in their doctor's surgery because it's becoming more expensive.
I think that can be important because often, your list may have sort of 6 things on it. There may not necessarily be time to cover all those at the time of the consultation, and often patients might come in believing, for example, that the repeat prescriptions are just going to be like a 1-minute thing, and there's lots of other stuff I want to talk about. But I think a good GP won't just automatically, double-click on the computer every time the person comes in for the repeat list of prescriptions. So there may be a conversation around, do you still really need that medication and that sort of thing. So lists are handy.
And of course, people can go to the Choosing Australia website where they can access all of this information at their leisure and pick up these tips on, first of all, communicating perhaps better with their health practitioners. There's information on the website there too, isn't there, about common tests. And you mentioned colonoscopies, which was interesting to me. So this is the health professionals compiling research and sharing it with the rest of the health practitioners, with the GP sector.
That's right. Yes.
And saying, for instance, it's not always necessary to recommend a colonoscopy.
That's right. So that particular recommendation, which is one of 70 odd recommendations up there at the moment, that particular one was talking about screening, colonoscopy screening. So I have to be very specific.
Sure.
This is not if you have a symptom. If you have a bowel symptom, completely different story, any bleeding from the bowel or something. But I'm talking about screening, which is, and it's recommended currently between the ages of 50 and 75, that Australians get what's called fecal occult blood testing, or the poo test.
Poo in the mail?
Yep, that's the one.
I've done it twice.
Very good. I'm proud of you. Many don't actually, and more should. But so the recommendation is that is actually an excellent screening test for bowel cancer for nearly all Australians. So there's about 2% of people who have a very strong family history or a genetic predisposition to bowel cancer. That's a different story. But for the 98% of Australians where that isn't the case, then the testing the stools is actually a better test than a colonoscopy. Not only better, it's also far cheaper. Colonoscopies cost the system around about $3,000 each. And it's simpler, it's easier, it doesn't involve the bowel preparation, and it also doesn't have the slight risk of bleeding after a colonoscopy or perforating the bowel after a colonoscopy, or indeed, the very rare risk of actually dying after a colonoscopy, which, perhaps happens in about 1 in 10,000 to 12,000 people.
And that comes back to our list of questions to put to the doctor. There's another example that I'm interested in hearing you talk about, Doctor, and that's type 2 diabetes, which sadly is becoming very common in society. Is that being over-treated as well? Over-managed?
The particular recommendation there was more around what's been considered in the past often to be routine blood sugar testing at home. So now sugar testing at home is very, very important for type 1 diabetes, juvenile onset, younger onset diabetes, and certainly important if you're on insulin. So even if you have type 2 diabetes and you're on insulin, it's very important to know your blood sugars and be able to test them at home. But it is felt that there's good evidence really that for people just starting off on diet-controlled diabetes, or perhaps one medication like metformin is the most common medication used early on, for those people there's actually no particular advantage in testing your blood sugar at home nearly always. There are exceptions, but for the average person, people who are interested can go and read the recommendation on the website. The recommendations each have the statement that it's not always useful, it shouldn't be routine, and then they have a description and the evidence. So describing the exceptions for some people do benefit from home blood sugar monitoring, but we know that a lot don't.
And of course, Big Pharma, the pharmaceutical companies, making money from this.
Sure. So there's I think there's about $180 million spent on home monitoring test strips, the little strips you put in per year. Now, a lot of that is completely justified, as I mentioned before, but certainly I think there's probably an overspend, and it doesn't all need to be spent. And ditto with pharma, of course, with recommendations against perhaps not needing so much of a particular medication. So a commonly overused medication is probably antacid, certain types of antacid medication, which are very effective and very useful in the right circumstances, but people tend to be put on them, particularly older people, and sort of stay on them for years and decades, and perhaps they're not necessarily needed.
And a lot of people do get caught up in, I believe the term is the cascade, the medication cascade.
Yes.
Is there a lot of that happening? And if so, how do you get off that spiral?
Well, I think there is a lot. I mean, about 10% of Australians over the age of 65 are on 10 or more medications.
Really?
If you include puffers and that sort of thing. So it's a lot of medication. Now, there's no blanket rule about the maximum number of medications you should have. Of course, there are many people who require lots and lots of medications, unfortunately. But on the other hand, there's a lot of evidence now that if you look at those people on, say, 10 or more medications, and you get a person to come in and closely look at each of them, so the GP ideally, there's a process called de-prescribing. Have you ever heard the term?
No, I haven't.
Okay, so it's where prescriptions have been given for a long period of time, and it's time to come in and take an objective viewpoint as to whether every single one of them is still required. And there's good evidence now that if you go into, for example, into a nursing home or aged care facility, or even someone living at home, but particularly the frail elderly, so someone whose quality of life isn't so good anymore, and you reduce certain types of those medications, then it not only improves their quality of life, it reduces their risk of falls, reduces the risk of confusion, and in some cases actually increases their quantity of life as well as that. So it's a very important concept, trying to avoid
that trap.
Yeah.
Yes. What advice would you give to people who are perhaps caring for older people and parents perhaps?
Sure.
Who they suspect are caught up in that prescription cascade? What advice have you got for them?
Well, I think, again, it's probably comes back to those questions. So clearly my advice would not be, just choose one and stop it or something like that, or I don't reckon they need this. It's got to be a scientific, logical process. It may be that the circumstances which did apply 3 years ago, and someone, it was very important that you lowered their blood pressure or cholesterol or something like that, maybe those circumstances no longer apply because the patient's living situation has changed or other medications have come into place. The bottom line is it really is a matter of reviewing it with your general practitioner ideally, particularly if the medications were started by 4 or 5 different specialists over a long period of time. There's got to be someone who's in charge of that list in the end, and usually it is going to be the GP. And
I'm wondering if GPs themselves feel a little compromised or trapped in that cascade because Auntie Joan or Uncle Bert expects to get that prescription written out for them because that's what they're used to. So they're meeting patient expectation.
I think that is a real trap. I think it's quite difficult. I see it myself. So, someone comes in with a new single symptom. They're already on sort of 8 or 9 medications. And on paper, there is a medication which is written, and if you Google it, you look it up, it will treat that symptom. But, and if someone comes in always with the expectation of a pill to fix every ill, if you like, they are going to, it's very easy to just keep adding one more medication at a time. But, I think a good comprehensive assessment will really sort out that there may be some potential benefit in adding one more medication, but you also have to realise there are potential harms in adding it, and it's a real balancing act often.
Yes, clearly, but choosing wisely is giving a great deal of empowerment, really, to patients and to consumers. It's a place to go and get fact up, as they say, and learn about it, and then hopefully have that easy conversation with their health practitioner.
I think it puts the GP or the doctor on the right page, it gets them thinking the right way, and it also helps the patients get a bit of background information.
We're seeing a lot of advances, Doctor, in medicine every day. For instance, genetic testing. That's a whole Pandora's box, I would imagine, because would you recommend people leap into that?
Well, I mean, it's a Pandora's box where the lid is opening rapidly, of course, and the cost of genetic testing is come down by it's 100th the cost it was even 10 or 15 years ago. So more and more there's more and more availability. There's more known about it. There are private companies also offering genetic testing. Making a bit of money out of it as well. So there's lots of pressures, and the difficulty with genetic testing is that there are so rarely black and white answers from gene testing. You can test for something. You could test for
Alzheimer's.
You can test for your increased risk of developing Alzheimer's, or indeed depression, or a host of other things. Breast cancer is a well-known example. But you have to realise that what's in your genes is not the only thing that drives it. So then the question becomes, well, what do I do about this? What do I do about trying to stave off Alzheimer's if my gene test says I'm at somewhat increased risk? The answer to that, probably at the moment, is all the things which we tell people anyway, which is live healthily, don't smoke, drink in moderation, keep your exercise up, do your cryptic crossword or whatever it might be.
Very good advice from our GP, Dr Justin Coleman. Let's just recap before we wind this up, Doctor. Firstly, do I really need this test or procedure? What are the risks that are involved? Are there simpler, safer options? What happens if I don't do anything at all? And finally, what are the costs, and not just in a financial sense? How can people find out more about this campaign, Choosing Wisely?
Okay, if you go to the Choosing Wisely Australia website, there's a list of all the recommendations in detail, and also lots of consumer help, such as the 5 questions and things explained simply.
Yes, and hopefully those conversations with the GPs will become easier, and we'll have better outcomes all round. And hopefully, by now, your pulse rate should be resting comfortably, Doctor. Thank you very much for your time.
My pleasure.